everyone, welcome back to my channel. My name is Dr. Teena, and in today's video I'll be sharing the last minute important topics for MC exam. Well, I know all of you have studied already so many topics, all the material you have, and the main purpose to make this video is that, see guys, there are some important topics which we all know that they're going to come in our exam 100%. Okay, and what do we do is we study, but we don't pay much attention to that specific topic. That's why I thought, let's just make this video. And what you can get in this video is, these are the topics whose probability of coming in exam is almost 90 to 100%. Okay, so don't miss these topics. Okay, only purpose to make this video is that you must read each and every topic mentioned in this video. And so many of the topics you must have already read, but if you didn't, so do it now. All right, so let's just start it. So number one, hemorrhages. We all know that this has come in, this topic has been coming in exam since last 5 years. Okay, EDH, SDH and SH, ये तीनों टॉपिक एग्जाम में आता है, एंड आई एम 100% श्योर दैट इट विल कम इन एग्जाम अगेन. So make sure you know the radiological images of these three hemorrhages. ठीक है, which artery or vein is defected, and what is the special sign or symptom you can see in this type of hemorrhage, and what is the treatment for particular hemorrhage. ठीक है, this is the main important points you must know about hemorrhages. Okay, so this is 100% question, is 100% this question is come will come in your exam. Cool. Next, Beer's disease. We all know that this is a very important topic, and there are possibility up till 90% that this topic will be there in your exam. So read it nicely. Basically, the mostly the question is always like this: the history of smoking is always given in exam, and patient has pain while walking. So just you will get the idea while reading. So just make sure you read the vasculitis topic, which I have already given in my other videos. I have provided the chart also, in which I have made all the vasculitis of large vessels, medium vessels and small vessel vasculitis. So just read each and every vasculitis topic in detail, or at least read those specific words which will give you hint in exam. Okay, next we'll talk about multiple myeloma. See, you have seen that this topic has come in exam multiple times. Okay, there are other topics as well which have come in exam, but this is very 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 important, I would say. So make sure you read multiple myeloma. ESR is 100. There are some important points we all know. Okay, what is the radiological features you can find in x-rays. Okay, and what else, crab features, just read this. Okay, next, iron deficiency, folate deficiency and vitamin B12 deficiency. It can come in form of pathology question, or it can come from medicine part also. So just make sure you know what is the pathophysiology. Okay, what will be the feature of this and how to treat it, or if there any images are there, so just read them nicely. I mean, there are 100% chances of coming this topic as well in your exam. Either of one will come in exam, so just read them thoroughly. All right, and if I'll talk about this topic, vitamin B12, it can come sometimes. The same topic comes two time, in part 1 and part 2 as well. So just make sure you study these topic very well. Okay guys, next, PCOD, endometriosis and adenomyosis. Out of these three, one will come in exam 100%. Okay, I have provided my charts again. Okay, it consists of 1.5 pages, and you can read them nicely, and they are very concisely, short written notes. So just read the important points and learn it. But the main motive is that these are very hot and highlighted topic which are going to come in your exam. So make sure you know all these topics before exam. Do or read however you're reading, do whatever you're doing, all the material you are thinking of studying in this week, it's up to you. I'm not interfering in any of those, but make sure you know at least these topics. Okay, if these topics are will come in exam, so you will have at least 20 to 25 marks in your hand. So make sure just read all these topics. Next is nephritic nephrotic syndrome. I have mentioned about this topic multiple times in medicine video as well, in my 20 importance topic video as well. So make sure you study these two. Okay, all the three diseases come under these. What are the features and what you can see in electron microscope, light microscope, and what is the treatment of disease. Okay, simple. What are the clinical features as well. ये 100% एग्जाम में आएगा. So make sure you read these topics very well. Pheochromocytoma, 100% chances are there it will come either clinical features or in a clinical scenario it will come, or what is the treatment for this. Okay. Next, Wilson's disease. Again, Wilson's disease has also come multiple times in exam, so make sure you are reading this topic very well. All the important key features, key points you must know. Okay. Next, Wolf Parkinson disease and cardiac tamponade. See, I don't know why, but I have this gut feeling that these two topics are very easy to understand and they will definitely come in exam. And I have seen also in PYQs that there are multiple questions in almost every FMG exam related to these topics. So just read them, and they won't take more than 10 minutes or 5 minutes, I would say. So just why not read them? All right. Next is cardia and C esophagus. ये बहुत इंपॉर्टेंट टॉपिक है. वी ऑल नो दैट दीज टू are always confusing when we are talking about in terms of radiological images. All right, so make sure you know both of these and their differential features, and you're good to go. Important topic, very important, and especially paper 2 question. Okay. Next is vitamin A, B, C, K, E, and zinc deficiency. See guys, this I would say that vitamin topic is so extremely important that 100% I can say two questions at least I'm talking about. Okay, at least will come in exam. See, statically if you'll go now, you will find so many questions that you already know that they are going to come in your exam, right? So better at least you have the idea of this video. Just read these topics and be ready. Okay, vitamin A, B, C, what are the clinical features you can see in patient who is having deficiency of particular vitamin. Okay, and the enzyme, coenzyme, all these you must know. There are not too much things. I have provided vitamins chart in my 20 important video topic. You can get it from there. Zinc deficiency is also very important. Basically, I have given in that chart only other important deficiencies as well. So just read those carefully because it is going to be there in your exam 100%. And we will talk about especially vitamin B. Vitamin B has so many types, right? 1, 2, 3, 5, 6, 12, 9 sub exam में any one of these can come. Okay, and it can come in a form of biochem question or in a form of pathological question. Anything, you have to be prepared by yourself regarding especially B, vitamin B I'm talking about. Okay, all the co-features, coenzymes, clinical feature, everything, and their treatment, everything. Okay, highlight this. Moving on to next, biomedical waste management. See guys, very important topic and rather easy topic I would say. So make sure you study this as well. मेरे important 20 topics वाले video में I have already mentioned and I have explained also what was my tricks to remember all the differentials, so you can check out that video as well. Next, juvenile nasopharyngeal angiofibroma. See guys, this is very important, very important topic, and there are 100% chances of coming this topic into your exam. And see, there are few important features I would say that they will give the history of a teenager. Okay, nosebleed history they would give, like that. Basically you just don't have to get confused in at that point of time. Make sure you study the clinical scenario, like how that patient will present to you. Very easy, rather important topic will come in your exam, so make sure you read it very nicely. All the features, important points and treatment, everything, and images as well. So this is very important topic. And one more thing I would like to say guys, see, I saw so many people that they don't focus much on ENT. So guys, ENT is a very scoring subject, I would say. I don't know what's the matter, and I've also explained that in my ENT video, that see, ENT is very scoring as well. Very direct question comes in your exam. Okay, basically, if I'll talk about from larynx, and from nose, and from ENT ear prospect, I would say there are questions which are confusing, I know, but very those topics, those who are very clinical, I would say, you can at least read them very well. So make sure you study those topic which I've mentioned in my video of ENT. Especially I'm talking about ENT, okay? And juvenile nasopharyngeal angiofibroma, again I'm saying this is 100% MCQ, must read. All right, now similarly next to it, rhinoscleroma and sporiodosis. See, these two you have to study in differential manner. Okay, so what's the best part is this, that when you do MCQ over there during exam as well, you will get the topics, multiple points you will get, and on those multiple question you can remove one by one out of which is your answer. So it's better you choose, you study these in a differential pattern, so that would be better. Okay, next, acute epiglottitis and croup. See, we all know this has come in your PYQ so many times, and these two are confusing, and mostly the causative agent of both of these. So make sure you study these two in a differential manner, again I would say. And what is the important clinical feature seen in these, and you're good to go. Very important topic and rather easy topic, and if you'll revise them now, you will, it will stay in your mind. Okay, next, Zenker's diverticulum, and this is very important from anatomy perspective, surgical perspective, and ENT perspective. So it's better you study this topic very well. What's the treatment option? What's the operation done in this case? Okay, and what is the pathophysio in this? Very important and has come in your in PYQs multiple times. So focus on this. CA breast. CA breast. Make sure you study all the information you can study for this. Okay, I would say this is the only topic about, I'm talking about cancers in total 19 subjects. This has highest probability of coming in your exam, so make sure you study CA breast. Okay, breast abscess and fibroadenoma, they're small tiny topics, just read them because sometimes it comes in your exam, so it's easy to learn and read as well. So make sure you study during reading CA breast as well. Next, burns, 100% MCQ will be there. So study burn, its formulas, treatment, types of burn, everything. Not you don't have much material about it, just read those. Okay, that is more than enough. Very important. Next, basal cell and squamous cell carcinoma, and together with this, malignant melanoma. These are skin cancers which are there in our surgery topic material, and rather very important topic. Okay, it can come in a sense of it can come in a form of a clinical question, image based question, from derma perspective it can come. So it's better you study these topic. What's the clinical feature, how it looks, how to diagnose, what's the treatment option, simple, nothing else, and their images as well. This simple and easy topic and very important topic. What happens, we what usually happens is we stuck in this only, that there are surgery topics of appendix and all the systemic surgery I'm talking about, but we forget these types of topics. So it's better if you study these topic, it will help you definitely. Next, congenital hypertrophic pyloric stenosis and congenital diaphragmatic hernia. See, these two are from pediatric surgery and rather easy and important topic. Okay, their images, their radiological images have come multiple times in exam and they are important. So make sure you study. Next, testicular torsion and acute epididymis. See, testicular torsion is very important, and acute epididymis, because this has come in your exam again, I would say, and sometimes you get confused in both of them. So it's better if you study both of these topic in a differential form. Okay, next, central retinal artery and venous occlusion. We all know that in if you talk about ophthalmology, these two have come in your exam. their important point, their image, and treatment options. See what happens, we go so much into depth that we forget the main features. Okay, so what I have did during my preparation in the last few days, I would say that I have studied only the topics and their highlighted features only. Okay, because what happens in exam, that one important point or one important word gives you complete hint for the answer. And this has happened to me. I was reading question, I get that one single point and I was like, this is the answer. So it's better do it like this. Visual field effects, we all know it is very very important, and there are 90 to 100% chances of coming into your exam. So it's better if you study that chart. Okay, and make any mnemonic you can make and just remember. Okay, visual field effects very important. And for orthopedics, I would say I don't like this subject, but cancers images, ठीक है, and fracture images, these two, and all the others planes ये सब you must know. Okay, just see the images and learn. See the images and learn. There will be nothing more than that in ortho, I would say. If somebody is there who is like me, who don't like ortho and they haven't studied it, so my important advice to you is study cancers, basically their images. Okay, on one important feature of that particular cancer, that's it. And fracture, same goes for fracture also, ठीक है, bus, that is more than enough for ortho especially. And yeah, see, this is ortho, these are the cancers of ortho. I made this chart because I don't like studying ortho, so I was like, okay, I want it in one page so that I can revise it in one single day or minute. See, these are malignant. Basically, I have write the important point of these cancers, so you can use these notes as well. Okay, just to revise, these are some important points from my notes, especially for physio, sorry, patho. Okay, you can have a look at these. And these are some pediatric cardiology, what is seen in what, you can understand it very well. And these are very important from perspective of radiology. See, these are the skull images I made with these are my handwritten notes. So what kind of radiological image seen in what kind of condition, like in multiple myeloma we will see a raindrop skull, or eosinophilic granulomatous we'll see geographical skull. Basically these are the points which will give you uh, hint in exam during. Then next we have all these conditions, you can read them. Okay, and if you want I will send this. And this is for all the vertebra images. Okay, what we can see in what case, like fish mouth and cod fish we see in sickle cell anemia and in osteoporosis, and in achondroplasia we see bullet shaped vertebra. Basically I have made this chart so that I can read these in one place only. Okay, here it is. So that's all for this video guys, and I hope you like it. And if you want these important notes points, just let me know and I'll upload this in my channel. And again, I can say it's a request or a advice to you guys, must read these topics. There are 90 to 100% probability of coming into your exam, so do good to you and to your exam and read this topic very well. And all the best. And if you have any doubt, anything regarding exam, so just ask me. Few days are left, and get set go, aag laga do. And all the best to each one of you. Bye bye.